So are in here, and we are back for another video. And today we're going to discuss about the culture in the hospital and the patients here. And this is actually for those who are new here, new nurses that's going to be migrating here in America. So stay tuned and roll the intro. Okay, so we are back, and I already clocked out. I was thinking about when I was about to uh, migrate here. I attended actually a culturation seminar, so that I'll be aware of what my pace is gonna be here. And it was like a whole day, I think. And I don't think a lot of nurses has that kind of seminar before they travel here. So that's why I was thinking to do another one here. I got 10 lists that I can give to you. So let's start with number 1. And if you're gonna be working here and you'll be meeting your patient for the first time, expect that the patient will ask a lot of questions. So you have to be ready when you go inside a patient's room. You have to be aware of the medication, all its signs and symptoms, why you're giving it to them, and what's the reason why you gave it to them, what's the reaction or side effects. And they're gonna interview you a lot, really. So a lot of questions when you go there inside the patient's room, so you better be ready for it. You have to be knowledgeable. That's the number 2, actually. Like I said, you have to be ready. So 1 and 2 is kind of like interconnected. And then let's go to number 3. Then the next one is gonna be, patients here are so dependent on medications, especially pain medications. Just to give you an idea, in the Philippines or Filipinos, if they have pain, they just try to, just try to bear with it. And there's kind of like a dignity on it if they can hold it, something like that. One example is that if a lady has a labor or you're delivering a baby, they don't like anesthesia or something like that. They just want to give birth to the baby without any medication, and that gives them pride. But here, you have to give them pain medication. Don't think that they can just hold it, like tablets. It doesn't touch them. Morphine, like IV pain medication, that's what they want. And you have to follow the protocol to somebody passed by. You have to have a criteria before you can give it to them. But if they're having pain, tell the doctor that it's not working, and they will give the orders. So pain medication is always used here. And then the next thing, I'm gonna transfer because a lot of people are passing by there in that area, and they always stare at me when I'm doing videos. Anyway, the next one is kind of like connected to, and that means pain is not allowed, sort of. Here, people here doesn't tolerate any pain, and that's the thing that you're gonna work on, so that like I said earlier, to make their stay a little bit comfortable. So yep. They say nasty thing here sometimes. When I was new here, somebody said the F word to me, and I was like, oh, he said that to me, oh my god. And I couldn't sleep at all the first time I heard it. And nobody said that to us. You know, in the Philippines, you don't really hear that a lot. We know the meaning of it, but when you come here and you hear that, it touches your heart really. But that's their normal thing. You can say nasty things like I don't want to say it. Maybe a lot of uh, the children are watching my videos, but they say nasty things here, and you have to be strong with it, and it's part of their, you know, culture that they can say anything that they want. Freedom, you know, freedom. But yeah, they can say nasty things, and as long as you're calm and able to respond to them in a professional way, that's part of it, part of the work. Okay, number 6. They are easily pleased. So if you're nice to them, if you do an extra mile for them, they'll appreciate it. Um, there's a lot of instances that they give you card, they give you like food or something to enjoy when you're working. So they send stuff in the hospital, which is good, right? So they're really appreciative here. If you're doing your work, and especially when you go beyond, they will cherish it. If you don't follow protocols, your coworker will report you. So don't expect that they're gonna be easy on you if you miss something. That's kind of like a culture here to be able to cope up with the standards and for safety. The people here are so frank. It's like internet. They don't have any breaks. So if they feel like something, bad, they will say it to you. For example, a Filipino might, accidentally drop to the floor, hit the knee, and then somebody will ask them like, "Are you okay?" And then they will say, "Oh, I'm okay." That's the usual thing, right? We say okay, but it's really hurting. Here, they say it really hurts. Number 9, most of them are all open-minded. You can say anything, they can say anything, but at the same time they're all open-minded. Whatever you say, they'll listen to you. And if you want to recommend something, they will consider it, think about it. But the thing is that you need to explain it to them, especially if you're new here and you're English or you don't have any skills yet to explain things. So that's gonna be the thing that you're gonna be working on, to explain things. And if you are able to give the message, then they are open to it. Okay, and then this is the last one, which is number 10. All my explanations are short, right? I don't want to tell you so much because you're going to experience it when you're working. So number 10 is that you have to find a way to communicate with your patient. So there's a lot of Spanish people here that doesn't know English, and there's like a computer that you can use. There's a telephone you can use to interpret what they're saying here. So you don't end by just saying, "Oh, I don't know his language," or something like that. You have to know what the patient wants and needs, and so that you can give a good care to them. And if it's a communication problem, you have to find a way to get the information that they want to relay to you. And then your work doesn't end there because of the language barrier. So sum it up, I got 10 tips for you. So new nurses here, I know you have a lot of things that you have to do and research and read, but I hope I can give you a little bit with regards to the culture here in America. So thank you for staying, and that's gonna be the end of my video, and this is the end of my shift. I'm ready to go home and sleep. Okay, so thank you very much for watching, and till next time. Bye-bye.